quite often when we're looking at back stiffness and the beginnings of back pain, one of the places I want to clear out of the way straight away is what's going on in the hip and how mobile is the hip. Does it move well? Because if we don't have a mobile hip in both sort of getting good, especially hip flexion and the rotational ability of the hip, then we will look to find that movement elsewhere. So in essence, if we don't flex as well through the hip, so you can't maybe touch your knee to your chest when you're lying down, you'll start to look possibly for more movement through the spine. It's not that we can't move there or shouldn't move there. Yes, we definitely should. It's just that we don't want to find extra movement there when that movement should be occurring at a different joint. And it's the same with rotational movements. So if you haven't got good internal external rotation, then again you'll start to look for it in the lumbar spine. Now again, as before, it's not that it can't move there, but a bit unlike flexion and extension where the spine can move reasonably well, it's really not good at rotating. So if we take an extreme example really in some ways, where it would be perhaps a golfer, where having good internal and external rotation in the hip is imperative to getting a good clean swing. If they haven't got that, then they really are going to start to try and maximise the rotation in the lumbar spine, which is really, again, let's say it's not what it's designed for. It's fine flexion and extension, but the rotational ability of it isn't great. We'll get a lot more rotation through the thoracic spine, and obviously our cervical spine rotates very, very well. I mean, it's really good at it, but the thoracic spine actually rotates pretty well, just again the shape of the joints. But when you come down to the lumbar spine, the joint shape is such that the rotational ability isn't that great. Flexion and extension, let's say, is fine. So you really want to have a good rotational ability in the hip, and it's a great place to start with anybody that's complaining of back stiffness, especially all the way up to back pain, etc. But if you're catching somebody early where there's just sort of niggles starting to occur, I always find if I clear up the movement in the hip, return full hip flexion and maximise the rotational ability, it's amazing just how much the stress is reduced on the lumbar spine, such that this unwarranted tightness just from overwork starts to disappear. So let's say a tip, if you are, especially say if you're a golfer, anyone where there's a requirement for the hips to rotate, so that's things like racket sports, anything like hockey, rugby, football, where there can be a lot of cutting, turning, sharp changes in direction. Good hip rotational ability is definitely something that should be worked on. So hopefully that'll give you some places to look if you're starting to feel as though your back's just stiffening up a little bit and you're involved with maybe some of these sports.